Hi, this is Christine Pierce, Director of Children and Youth Empowerment. I am here with Makenzie Jordan. I'm very excited to present her to you because she is going to be sharing some information for us that is applicable to our ministry, especially as we're going into the winter months that sometimes we get a little less vitamin D. So I think it's even more important for us to understand our mental health and what we can do to help our students. And again, this is Makenzie Jordan.
Awesome. Thanks so much, Christine. All right. So today we're going to be talking about trauma-informed support with children and adolescents. And so if you saw my first presentation in the series, this is a brief blurb about me. You probably already heard it. So I'm a wife, I'm a dog mom, and most important, relevant to this presentation is I'm a licensed professional counselor. And so some of my roles, I work with a hospital and I help run a school-based program where we get children and adolescents free counseling in school districts. And then I also work at a private practice and see individuals there. A lot of my clients are coming with trauma, and a lot of them are adolescents and young adults. And so, I love just providing education to others, not representing any of the works that I'm with, but I'm just here as someone that likes to pass on information that they have learned, their time in their career as a licensed professional counselor. Okay, and so just like I did last time, I gave a little bit of a warning. Some of the topics that we'll be talking about today can be heavy topics. We're talking about trauma. Again, we're just kind of touching on the surface of trauma and really just providing a lot of education around it. However, that doesn't mean it can't bring up big emotions or painful life experiences. So if you are listening to this and you need to take breaks or need additional support after this presentation, please feel free to reach out to me. I have my email at the end. I'll be glad to connect you to someone that can provide you more support. Okay. So today, like I said, we'll be talking about trauma-informed support with youth. And so meaning by that, the support that you give, the children and adolescents that you're working with, how can we be trauma-informed whenever we're interacting with them and providing care? And so these are the questions that we're going to tackle today. One, what is a traumatic event? Secondly, what are common reactions to trauma? What can be the impacts of trauma, particularly childhood trauma? And then what does it look like to provide trauma and informed support? So that's what we'll tackle today. And so again, there's so much information out there, especially regarding trauma. I feel like this is talked about more than ever. And so please know that this is a highly condensed version of a very, very broad topic. So if you want more information, you're always welcome to explore some of the resources that I have at the end and references that I have. And you're always welcome to reach out with questions. Okay, so what is a traumatic event? So we'll kind of start with the basics here. The National Child Traumatic Stress Network, one that's a great resource to look into. So you're welcome to look at their website and get a lot of good information, especially regarding childhood trauma. But they define a traumatic event for youth as a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. So any traumatic event can initiate strong emotions and body sensations that can last long after the event itself. This includes even witnessing a traumatic event. And when I say witnessing, I'm not even necessarily saying witnessing with eyes. This can be even just hearing. We could talk about events of domestic violence, threats to a loved one, specifically a caregiver. Those can be seen as traumatic events, even if they are not, in the traumatic event or witnessing it with their eyes, can still be a trauma. And this is particularly important for us to know when working with youth. Their sense of safety depends on their attachment figures. And so attachment figures can look like, of course, parents, it can look like grandparents, it can look like a steady caregiver, like a nanny or a babysitter. Um, but just something for us to be aware of is a lot of times that safety is perceived within those attachment figures. And if that is threatened, that can be seen as traumatic. And like I mentioned earlier, any traumatic event can initiate strong emotions and body sensations that can last long after the traumatic event itself. And we'll talk more about what that can be. So the list that I have before you, this is a list of traumatic event examples. Um, Again, it's important to note that this list is not exhaustive. And to one person, they may perceive something to be traumatic for them, that perhaps to another person, they do not view it as traumatic. So we really can't define that for anyone. The individual itself has to define if it's a trauma. But it looks different from person to person based on their experiences. Additionally, you'll notice that many of these events are likely not a one-time event. So please remember that trauma can be ongoing and it can be complex and chronic. And so when I'm naming off these examples, very likely it's not a one-time event. Very likely it can be over a span of, months, years, whatever it may be. So some of the examples can include when we're talking about trauma. I think what people generally think about is abuse or neglect. And so remember with abuse, this can look like physical abuse, or harming someone else's body, sexual abuse, emotional abuse, and then there's spiritual abuse. And so that's something that I think is more talked about nowadays, especially in religious contexts, that can be an area that can be abusive. Is that spiritual abuse, that power differential of having someone, an authority figure, leading other people. And so next we have neglect. You may have heard this word. If you're not sure what neglect is, it is when a caregiver or someone of importance is not meeting a basic need of a child or someone who's vulnerable. And so that could look like not providing appropriate shelter, not providing emotional connection. That could look like not, giving appropriate nutrients. It can look like many different things. Exploitation, you've probably heard about this a lot, especially when it comes to human trafficking. A lot of times people think of sex trafficking, but a lot of times it can also be labor trafficking, especially when we think of people who are immigrating to the States. It can look like children, people under the age of 18, having to work in conditions and possibly groomed into those conditions, thinking that they are choosing it, and then they generally are not choosing it or feel like they're unable to leave that situation. Natural disasters, obviously, that's something that we see often in the news. With some of my works recently, we had tornadoes in the spring. And so a big part of the children and adolescents I was working with at that time was, of course, maybe losing their home, maybe losing just stability of their routine, having to stay at the school for a few days while they get a new living situation. Natural disasters can cause a lot of different traumas. And again, even though it may be a one-time event of a tornado, there's ripple effects of that, such as losing housing or not having a stable environment anymore. Family, community, or mass violence. Again, this is super broad, so I'm giving really broad examples here, but some of that may look like domestic violence within the home, gang violence within a community, school shootings, terrorism, war. all of those things could be under that category. Bullying, of course, we hear this especially a lot with children and adolescents, and that can be physical, emotional, and cyber is one of the newest ones that we hear about often. Cyberbullying, even from people that they do not know. Of course, loss of a loved one, or it doesn't even have to be a loved one. It can just be a loss of someone that, again, is maybe a stable figure for them. It could look like a loss of a teacher. It could look like, a loss of a friend, anyone of that sort. Traumatic separation. This is one, especially nowadays, we're seeing with immigration, and then also incarceration. So this traumatic separation of the caregiver from a child or adolescent. Discrimination, prejudice, and racism. Again, many different examples of that. We saw, I guess it was 2020. Everything's a blur since 2020, but back in 2020, when we had Black Lives Matter movement, that was George Floyd's death was a traumatic event that was seen nationally. And so that's a good example of trauma within racism and discrimination. Serious accidents or life-threatening illness, of course, you can think of what that may be. Substance use disorder, especially within a family, growing up in a household where maybe a caregiver struggles with alcoholism or use of drugs. And then just another example is military family-related stressors. And so again, that can be really broad, but maybe a military family that is experiencing deployment of caregiver injuries, of course, death could be a risk of being a part of the military family. And then, of course, frequent moves as well. So those are just some examples. Again, this could look really different from person to person. One person may view an event as traumatic, whereas another person may not view it as traumatic. And so thinking of those experiences, we're now coming to this place of what would be common reactions to trauma and maybe some of those experiences that we just talked about. And so we have 4 big categories. And so we first have re-experiencing the trauma. And so when I say re-experiencing the trauma, this is what you think of when you think of like flashbacks. This could be nightmares, unwanted thoughts, or memories of the event itself. Perhaps they feel intrusive if you can't get rid of them. And then the flashbacks, feeling as if you are back in the event itself. The next category would be avoidance of trauma reminders. And so this would look like avoidance of maybe people, places, things that remind the person of the trauma. A good example of that, I had just watched a movie the other night that was about school shooting. And so the adolescent in that movie, their reaction to it was avoiding school. And so not wanting to go back to that place where the trauma happened, not wanting to even engage with the students that they were hiding with. Those could be examples of avoidance. Avoidance of activities related to the trauma. And then another aspect of avoidance would be suppressing thoughts or avoiding conversations about the trauma. Negative thoughts or feelings. Again, this is a really broad category, but within this category, it could look like excessive blame towards self or others related to the trauma. So a good example that we hear a lot in domestic violence situations is that the child will blame themselves for, parents fighting, when ultimately we know it has nothing to do with them. And so that excessive blame towards self. Loss of interest in activities. So no longer, one of those suppressive symptoms, no longer interested in things maybe that they used to love. Feelings of isolation or disconnection to surroundings. And so particularly disconnecting from, relationships that they have, and then disconnection from surroundings. What I mean by that is a term that we call dissociation. And so having this feeling of being removed, possibly from your body, from the experience, feeling like you are not currently present in the moment. And so one of those feelings that trauma survivors often feel is that they cannot connect with their surroundings, maybe as if their head is in a fog. They feel dissociated from life. Some other reactions could be difficulty experiencing positive emotions. So, in that time after the traumatic event, it could be hard to experience emotions of joy. It could also mean, if you do feel emotions of joy, feeling guilt about having emotions of joy after such a traumatic event. Loss of memory related to the trauma. And this just goes back to our biology. So whenever we have a traumatic event happen, our brain tries to store the information quickly. And so when we have an event like that, that is really overwhelming, especially to our senses. So like our sensory system of like taste, touch, smell. What happens is sometimes our brain will not store that information correctly, and it will store it in a spot where we have a harder time accessing it, and accessing it from our memory, which is a whole nother thing. If you want to learn more about it, there's a lot of info out there. And then lastly, in that negative thoughts or feelings category, another example would be difficulty forming attachments. And I say that specifically when we're talking about children and adolescents. Again, that having attachment, especially to caregivers or important figures, that could even be y'all, having kids in your youth group that have an attachment with you, perhaps after a traumatic event or chronic trauma. It is hard to form attachments like that, and feel safe to form attachments. And then that last category, hyperarousal or body sensations, that can look like heightened startle reaction. So of course, like kind of that being on edge, jumping, or having sensory reactions to things that maybe they should not have sensory reactions to. Lack of concentration tends to be a big one. That's something important that I like to note, especially when working with children and adolescents. We hear a lot about ADHD nowadays, which is true for some children and adolescents and adults. However, when we have children and adolescents that have trauma, perhaps multiple traumas in their childhood, their lack of concentration can look like ADHD, when actually the root of it is trauma. So that's something just to keep in mind, especially if you're working with groups of children, and maybe you have a more hyperactive child or someone who's not able to pay attention. Behavioral regressions is a big one, especially with children with trauma. So this can look like tantrums, maybe not age-appropriate tantrums, difficulty separating from a caregiver or an important figure. Wetting the bed can be a big one as well. Some of those regressions that they developmentally should have moved past that, but maybe have regressed to younger developmental stages. Difficulty sleeping or eating, that's always a big indicator of adjusting after a recent trauma. Feelings of anxiety, risky or impulsive behaviors, especially when we're talking more about adolescence. That can look like substance misuse. It can look like risky sexual activity. An example that is not always the case, but sometimes we hear about a sexual assault survivor may engage in more sexual behavior after a traumatic event like that to try and heal and take back power from the event itself. And then lastly, some somatic symptoms can be really common, such as headaches, stomach aches, racing heart, those kind of things. And so, although these are common reactions of trauma, experiencing trauma does not always mean that someone will develop these reactions or develop PTSD or post-traumatic stress disorder. And so these 4 categories particularly are part of the criteria that someone would need to meet PTSD disorder. However, there's really specific timelines on that, especially when it comes to different ages. So even if they hit symptoms in some of these categories, does not mean they would necessarily qualify for a PTSD diagnosis. So that's just something to keep in mind. It's really common to experience these types of reactions after a trauma, but if you are noticing a child, adolescent, or adult that is having worsened reactions over time, or it's significantly interfering with their daily life, that is when it would be appropriate to maybe seek more help, and that those common reactions have been developed into something more severe. So, of course, we're talking about some common reactions to trauma. And so now we're going to talk about more of what can be the impacts. So more of those long-term reactions, specifically to childhood trauma. And so if there is a lack of resiliency factors, which I will talk more about in a second, if there is a lack of resilient factors or healing from the childhood trauma, there could be some different impacts on the child and adolescent. And so I think I touched on this a little bit in my last presentation, but the ACE, the Adverse Childhood Experiences study, that was a longitudinal study that explored long-lasting impacts of childhood trauma from childhood to adulthood. And so these are some of the impacts that we see from that study itself. And so just a little more about that study. The results indicated that nearly 64% of participants, these participants range from age 19 to 90, 64% of participants experienced at least one exposure to a childhood trauma. And of those, 69% reported 2 or more instances of childhood trauma. So you are more likely to experience more events of childhood trauma if you already have one. And so the results from that demonstrate this connection between childhood trauma and then these impacts. And so for children, what we see some of those long term impacts can be is increased risk for viral infections, pneumonia, asthma, and other diseases, and then difficulties with learning or behaviors, learning disorders or behavioral disorders. And then for adolescents, this can look more like somatic complaints like headaches, abdominal pain, increased engagement and high risk behaviors, like I just mentioned, such as reckless sexual activity, so on. Teen pregnancy, sexually transmitted infections, mental health disorders, and then substance use. And so, like I mentioned, resiliency factors can help with healing from trauma. And so these are some factors that can be helpful for someone who has experienced a trauma or chronic trauma. And so these factors are important because they overall reduce the likelihood of children and adolescents developing further negative impacts from trauma, again, such as post-traumatic stress disorder. And so a minimal trauma history is going to be helpful. Being exposed to previous traumatic events in childhood may increase the likelihood of developing PTSD or other factors later on. Caregivers' reaction can be a big one, especially when it comes to children and adolescents. And so, this can, range for a broad amount of traumatic events, but how the caregiver responds to them, such as did the children's family believe them? So if they're reporting something traumatic happened to them, did the caregiver respond in a way that they believed the child? Did the caregiver take the child's reaction seriously? That can be a big one. How did the child or caregiver respond to the child's needs after a traumatic event? And then how did they cope with the traumatic event themselves as a caregiver? And so there can be an impact there if the caregiver was unable to cope with that traumatic event. It can then also um, be more harmful to the child that also experienced it. Another one would be being equipped with coping skills. I'm sure this is one I've heard about a lot. So just considering if the child has tools that they can use to assist them when they feel distressed, especially if they're experiencing those common reactions to trauma. And then support from the community. This can, of course, look like the support that y'all give to families regularly. And this can look like other people in the community providing support, such as teachers or other caregivers. It can be so vital for the child and the family recovering from the traumatic event. And so particularly for y'all, I want to talk a little bit about what would it look like to provide trauma-informed support. So just being mindful that if a child or adolescent or family have experienced a trauma or have complex or chronic trauma happening, how can we provide them support? And so I have 4 key points for y'all. The first one being establish and maintain physical and emotional safety, again, with the child, the adolescent, the family. And so when I say that, there's a couple things I want to point out. I want you to remember to remain calm and supportive and provide that safe environment when someone is telling you about a traumatic event, using non-judgmental listening, language, and reactions when you're hearing about some of these things that can be hard to listen to. One really, really important thing is we never want to force an individual to talk about their trauma or share details of their trauma. This can be re-traumatizing to the person. So we really want that to be done in a setting with a professional, or unless they choose to do so, if they feel like they want to share their story and share those things, that is up to them. But we never want to force someone to share about a traumatic event. We also never want to minimize someone's experience of their trauma. So again, just using that active listening, staying non-judgmental. If you're not sure what to say, it's okay to say nothing. Just being thoughtful on your responses, embracing silence and validation, whatever that may look like. Additionally, establishing physical safety can be really, really important, especially for children and adolescents that have experienced some type of trauma, particularly with physical touch. And so some ways that could look for you is asking permission and accepting no as an answer when engaging in touch, as well as verbalizing what movements you're making can be helpful, especially for these children that have been traumatized by touch. So some examples would be, asking permission before you give a hug, or saying things like, I'm going to put my hand on your left shoulder while we pray, anything like that, that can kind of give predictability to what your touch is going to be, is really important for someone who has been traumatized by touch. My next point is empower. And so what I mean by that is having awareness of trauma and its effects. And so for you, it's, of course, being educated in this area, just kind of staying up to date with trauma, with the new information that is coming out with trauma. And then providing, the kids and adolescents that you're working with just basic education about trauma, and then normalizing reactions can be really helpful as well. Additionally, providing choices and giving the power to make decisions, especially for a childhood trauma survivor, can be really beneficial. And so this can look as simple as providing a choice between snacks. I don't know if I'll give out snacks at your events, but it could even be as simple as, do you want Cheez-Its or do you want Goldfish? This can be really empowering for someone who has been traumatized. It could also look like, do you want to start with this activity or start with this activity? So either way, you're going to do the activities, but you're just giving them choice of order. So just being mindful of those ways to incorporate that, especially if you're doing, any sort of group instruction, providing them that ability to make choices. And then, number 3 is refer to professionals when needed. I think I talked about that the last time as well, and I'll probably continue to preach that. But if you are noticing a child struggling with trauma reactions we discussed for an extended amount of time, or the reactions are worsening, or it's affecting their daily life, prohibiting them from doing certain things, perhaps coming to youth group or going to school, that would be a time to maybe advise the family to go to a professional to seek out more support. And one thing that I like to remind families when I'm working with them is that children are extremely resilient. And so treatment with a professional is not always needed. I know that sounds maybe bizarre, especially when it comes to traumatic events. A lot of times families will come in and say, we've had a loss of a loved one. We're really worried about how our 6, 7-year-old is going to react, which is a valid concern. However, sometimes children bounce back way quicker and healthier than adults do. And so, that's something to just kind of keep in mind as well, is not everyone's going to react the same, especially children. And so, especially if families are delivering news to children about something traumatic happening, I think a lot of times families expect children to react in certain ways, and a lot of times they don't. And so just kind of giving them time and space, monitoring them, and then, of course, like I said, if over time we notice some of these common reactions to trauma are being more extended or more severe or impacting their daily life, that's when we would seek out a professional. And then lastly, practicing compassion and resilience. And I'm saying that to y'all as the people that work with children and adolescents. Working within this population means that we often hear their stories, and we hear a lot of their stories. Probably things that they don't tell other people because y'all have such a unique connection to them. So although we can provide support, it does not mean that we don't have feelings of maybe helplessness or powerlessness that come up when you're having to serve a population like this. Hear these really difficult stories and can only do so much to provide support to them. So those are really common feelings to come up for people that work in these kind of realms. So I just, encourage you to be intentional about caring for yourself, to combat, compassion fatigue, burnout, vicarious trauma. So maybe feeling traumatized by hearing someone else's traumatizing story, and then other related concerns. So just make sure that you have support systems in place, coping skills that you can use, and healthy boundaries to continue to do wonderful work with children and adolescents. Okay, so like I said, this is highly, highly condensed for the amount of material that is out there when it comes to trauma. So, we wanted to just quickly hit these questions and get some answers. And so a traumatic event, that's going to be a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. Again, this doesn't mean it has to be direct. It can also be indirect, such as hearing something violent or witnessing something. And again, a reminder, trauma does not have to be a single event. It can be chronic. It can be over someone's lifetime or many years. What are common reactions to trauma? Again, we have those big 4 categories. That's going to be re-experiencing the trauma, avoidance of reminders of the trauma, negative thoughts and feelings, and then hyperarousal and body sensations. What can be the impacts of childhood trauma? It's going to be long-term effects on overall physical and emotional wellness. And this can carry along into adulthood if untreated or do not have resiliency factors in place. And then what does it look like to provide trauma-informed support? We want you to remember to establish and maintain physical and emotional safety, empower the individuals that you're working with, provide them with education, refer to professionals when needed. It is not always needed when it comes to a trauma, but just keeping an eye out for the times when it would be appropriate to refer to a professional. And then with yourself, practicing compassion and resilience and practicing putting things in place to be able to care well for the kids and adolescents and families that you work with. And questions? Do you have them? You send me an email. These are my references. I'll leave them up here for a second. Like I mentioned earlier, particularly the National Institute of Mental Health can be helpful. And then the National Child Traumatic Stress Network, their website is super informative. So have a lot of good articles and just tidbits everywhere. So that would be a really good one to look up, especially as you work with children and adolescents. And if you need anything, you are welcome to reach out. This is my email. I'm always glad to answer questions as well as provide resources or anything you may need.
Thank you so much, Makenzie.
Yeah, of course.
It's phenomenal.
Yes.
I'm very grateful for your work here and your gifts here as well, because we just need to learn this so that we can do our jobs best and serve God as best we can.
Yeah, totally agree.